session is called Bounce Back, Bounce Forward. We have with us today Dr. Lindsay Weitzel and Margot Andersen. Dr. Weitzel has a PhD in analytical health sciences and a master's degree in nutrition. She works full-time as a migraine strategist and has opened a clinic dedicated to improving the lives of people with chronic migraine. She's also the host of Heads Up and wrote a graphic novel for kids. Margot Andersen has a master's in social work and is a registered yoga instructor and a certified mindfulness and meditation teacher. She specializes in teaching resilience skills such as yoga, mindfulness, meditation, acceptance, and self-compassion to people experiencing anxiety, depression, chronic pain, or loss. She's also on the board of the National Headache Foundation. Ladies, welcome and thank you so much for being here.
Thanks for having us.
Thank you. All right, everyone. So our topic today is bounce back, bounce forward. We are going to discuss some of the techniques that we work with people on, some of the techniques we've used ourselves on getting through chronic migraine. So I'm Dr. Lindsay Weitzel and Margot is right here, and we are both going to talk very fast. We have a lot to cover on a very important topic. So we just want to give you our backgrounds really quick, or why we do what we do. I'm going to go ahead and have Margot go first.
Hi, everybody. So I'm just going to let you know that I've had migraine disease for over 50 years. Was diagnosed as a teen, had a car accident when I was 8, but it's genetic. Was episodic until my mid-30s and chronic until my mid-40s. And I've had lots of challenges in life. I've had 2 benign brain tumors, infertility, bowel obstructions, and became chronic in my late 40s and became chronic intractable in my 50s after I lost my adult son. So that shock and trauma really put me into a tailspin. But most recently, several years ago, I had breast cancer. So I'm a successful breast cancer survivor. And why am I telling you all of this? The good news is I've gone back to being episodic as a result of CGRPs. But we want to talk a little bit about some of the differences between breast cancer survivor mentality and being a migraine warrior, and some of the differences in terms of the mindsets with that. One of the things I'm determined to do is to work in the area of advocacy to help us get the recognition that we deserve that really came to the forefront with breast cancer, and help us learn strategies to bounce back and be the Energizer Bunny and what I call fall down and get up in life. One move.
Okay, thanks, Margot. So I'm Lindsay. I'll give you just a brief history so that you know where I come from and why I do what I do. I had chronic daily migraine from my earliest memory, I would say at least the age of 4, if not earlier, until I was 30. It never went away, and it was so continuous that it gave me complex regional pain syndrome on the right side of my head, face, neck, and down my right arm. It's like a burning fire all the way down to your bones and your bone marrow. I did get significantly better at the age of 30. I still get a lot of migraine, and the CRPS is still there, but it's so much better controlled. I work with people who have debilitating migraine or any sort of migraine. I work with them one-on-one. I am the podcast host for the National Headache Foundation. And I had quite a complex migraine history. I had a migraine-related seizure that made me stop breathing. Thankfully, at that time, I was married to an anesthesiologist who got me to breathe again. I had some fairly complex things that we don't really have time to get into, but this is why I do what I do. And I look at this thing that we're going to talk about today as resilience. And when I talk about resilience, I think of it as how powerful is your true north. If you think of a compass, to me, resilience is how strong and how magnetic is that true north of your personality, and how quickly do you get back to it when something knocks you down. And so that's how I like to look at it. It is my personal belief that migraine has a job. It makes us feel like we lack control over our own lives, especially if it's chronic. It can make us feel like victims. It can make us develop bitterness. We can start to hate. We can start to blame. We can often feel like the universe has nothing good for us. We can lose our joy, our hope, and we can expect negativity. These are some of the things that is the job of migraine, to bring us down if we are not careful. It is our job to combat this. So here we have a picture of, to me, what the job of migraine is. It is to take your energy, your vibration, your mentality, your focus, your mood, your health, your entire life. People have various words for this, and do this with it. If you can see this line that I've drawn, it goes up and down, up and down, up and down, because our mood and our vibration, etc., does this. It's normal for it to go up and down. But I think that if you're not careful, chronic migraine will take it, in a downward spiral, right? If we aren't careful with watching ourselves and putting a ton of effort in. My belief is that if you put a lot of effort and energy into this mentality, focus, mood, that a lot of people get it to go straight. You can stay at a stable level of positivity, vibration, and energy. But our challenge for everyone today, oh my goodness, it did not show up. Forgive me, I don't know why. But my challenge to you is, if you could picture that line you just saw, and here it's going up and down, is to have it go up throughout life. I don't think there's a limit to our positivity, our positive vibe, our energy, our mentality. We want it to continually go up, despite the fact that we have chronic migraine or migraine. This is our daily job. And I personally put a ton of time each morning when I wake up into making sure this happens. One of the things that I think is hugely important is to never compare ourselves. Something is building inside of us, even though some of us are hugely sick. We wake up and it's more effort to get out of bed every morning than it is for some people that then they have to put in all day. This is a strength and a power, a resilience, if you will, that someone without migraine disease will never have. They aren't overcoming this. So recognize and honor this within yourself. Recognize how strong you are and how strong you're becoming. One of the most important things that you need to learn and understand, and you may already know it, but it's helped so much to hear it again and again, is that your thoughts are nerve signals. Every thought that goes through your head is as real as the pain you're feeling. And that there is data that shows, and I wish I had time to show you the data, but there's data that shows that there are certain thoughts that are proven to chronify a pain state. And this is one of the reasons I think that it's so common for migraine to chronify, because of the amount of pain and the amount of other symptoms that come with migraine, not to mention the fact that it often comes with depression and anxiety, causes your brain, whether it's your conscious brain or subconscious brain, to think you're in a high amount of perceived danger. How many of you, when you're lying in bed with a really bad migraine, you can almost hear it. Your subconscious mind is saying, I'm dying, I'm gonna die, I'm gonna die. Sorry, but I have had migraine my entire life, and I can still hear that dang thought. And I am always combating it. But if I'm really bad, I'm just sitting there, I'm dying, I'm dying. And we need to stop that, because that's one of those thoughts that we just know automatically tells your brain to chronify that pain.
So what is resilience? So many thoughts about resilience. If we were to define resilience, resilience is our ability to recover from adversity. And, we hear a lot about post-traumatic stress disorder from trauma that we have, whether it's trauma with a small t or a capital T. And we all experience trauma as migraine warriors daily with pain. But what we're finding in the literature and the research in the last 15 years is that there is post-traumatic growth, where we grow as a result of the obstacles and adversity that we face. We do not all suffer from post-traumatic stress disorder. We often go on to find new meaning and purpose in life. So what is our response to adversity? It's called response flexibility. So that means if this happens, if I'm having a bad day, what do I do now? If I'm really feeling sick, what's my plan? If I can't do something, what am I going to do next? And if you all could take your thumbs and hook them together and have your palms facing you, you create a butterfly. And on one side, so if you're wiggling your right hand, that's the wing of the butterfly that I call self-compassion. And on the other side, your left hand, if you wiggle your fingers, is the wing of the butterfly called radical acceptance. Radical acceptance or acceptance is accepting the fact that we have a chronic disease. But you can't do that unless you hold it with loving kindness. They go together. They're two wings. So if you're just overly kind, then sometimes you forget that you have to accept the reality. When you accept the reality, you do it with loving kindness. So resilience is all about self-compassion and acceptance. And we talk about migraine as having primary pain, or the first arrow being the headache or the body dysfunction. And the suffering is really that second arrow of the stories we tell ourselves, the narratives we get lost in, and as Lindsay said, the chronifying thoughts. All human beings experience adversity. Guess what? There is nobody has a pain-free life. Everyone experiences loss, betrayal, illness, family hardship, economic hardship. And as a result of this, we've been wired for 600 million years for fight, flight, and freeze, which worked really well when we were out on the savannah in Africa, scanning the horizon hypervigilantly for saber-toothed tigers. Doesn't work so well right now when we get a negative thought in our mind. And we respond with adrenaline and cortisol. So we have what I call, Lindsay called them chronifying thoughts, I call them ants. Automatic negative thoughts that crawl around in our head all the time. How many of you, I know I have, when you get a migraine, are like, oh no, what's going to happen today? Will I be able to go to work? Will I be able to go to this family event? What am I going to do if I can't go? And we just get lost in our thoughts. But we now know with neuroplasticity in the research that our brains learn throughout our entire life cycle. They never stop learning. And we can rewire and retrain our brain to a growth mindset away from a fixed mindset so that we leave ourselves options and choices rather than fight, flight, or freeze. We can have wise choices. So what are some of the daily spiritual practices that work for me? And I'm talking about daily. I choose radical acceptance and choose life every day. Every day, whether I'm healthy or not healthy, I choose to accept the reality of that day and to live my life to the fullest. I reach out, or I'm encouraging you all to reach out and engage with other people often. So often, it's so easy for us to just isolate and pull the covers over our head and just want to shut everybody off. It's so hard to interact while we're in pain. But there are things that we can do to soften that. For example, we know we can change our brain through a gratitude practice daily of going through a catalog of looking for the three good things that have happened in the last 24 hours. Or put your hand on your heart and kind of mush it around. This is a form of self-compassion. If you do that for 20 seconds, you release oxytocin, which counteracts panic and anxiety. And we say to one another, this is a moment of suffering. All humans suffer. May I be kind to myself in this moment. We're never kind to ourselves. And then there's the very old Buddhist practice and Hindu practice of metta, which means loving kindness. And that's a simple phrase to repeat over and over again. May I be happy. May I be healthy. May I be free from pain and struggle. May I be at peace.
Oh, we have a prize question, everyone. So we do want to point out that gratitude, again, there is a lot of stuff that we could say behind this data wise, but we're a little short on time, is really important in embodying this, making your energy go up throughout life. But we want to ask, is gratitude a list or a lifestyle? This is your prize question. And I just want to point out that this took me a long time to understand, because everyone would tell me, oh, find something to be grateful for. And I would come up with, okay, my kid is healthy, my dog is cute, I have a roof over my head. And I would just make this list, right? And then one day I got it, because this wasn't helping me. I was making things up without necessarily feeling grateful, instead of embodying a lifestyle of gratitude, where I drive down the street and I feel how beautiful the leaves are, despite the fact that I may have woke up feeling terrible. I embody how I feel that I love the way my kitchen looks today. Yeah, sure, I might want new tile, but I embody gratitude for how wonderful my kids are. Embody the feeling of gratitude instead of just making a list. And so this is why we have this question: is gratitude a list or a lifestyle?
To that, my license plate says grateful.
So this is a point that I really want to make. So we already talked about the thoughts. Thoughts are nerve signals, just like the pain, and they're so important in combating the pain. Your emotions literally cause physical pain. There's a lot of examples we could go through with this, but they cause something called pain amplification, both in your subconscious and your conscious mind. And I call it the migraine or chronic pain bicycle. So you've got your primary pain that comes in, you've got your migraine. Well, then you have all these feelings about it, right? And that's when you get on the chronic pain bicycle. And we know that we just ride a bike without thinking about how, okay? Well, your migraine becomes worse because you have so many automatic emotions and thoughts that happen as soon as it starts. And we need to learn how to stop this process. So this is something, put it in your brain, because we're going to talk a little bit about this. We need to change our emotions related to our pain.
We're going to talk about a paradigm shift. If we want to grow resilience, we need to kind of shift our thinking from being a victim, a person with pain as a victim, to being a person with agency and power, to feeling empowered. I had a wonderful teacher teach me once, never see failure as failure, but only as an opportunity to change course. If your medication isn't working, it's not a failure. You're not failing it. It's not failing you. Just use it as data to change direction, as if you were in a kayak on a river. You're going the wrong way, turn around. We always need, and we all know this, we need to have a plan A for our day, a plan B, and definitely a plan C. Find your voice, tell your story, reach out. We have so many online options now and wonderful groups and resources for you to reach out to so you don't feel alone. And for a paradigm shift, instead of being a victim, be a partner with your providers. And you need to see yourself as an equal partner.
I like to teach people to embody something I call the oncology mindset. And this is part of why Margot and I work so well together. She has experienced breast cancer, and I started my career in the breast cancer world. I used to be a breast cancer researcher and work with breast cancer patients. Now just picture me, I was born with daily migraine. I had vomited myself down to about 108 pounds, and I was working with people on chemo, and I was smaller than them. And I was so sick, but nobody knew. My disease was hidden. And that's where I started to see the difference between how people see people with cancer, breast cancer, and how we see them, and how we see people with migraine. And I also, how they saw themselves versus how people with migraine see themselves. So I think this is such an important tool in how we stick a stick in the spokes of our migraine bicycle. We need to see ourselves like the breast cancer patients see themselves. We need to empower ourselves and not be victims. So let's think about this for a minute. People with breast cancer are seen as survivors and warriors. People with migraine and chronic pain are seen as weak and anxious. People with breast cancer have identifiable markers of their disease. People with migraine and chronic pain have no marker or visible proof of their disease. people with breast cancer, everyone in the world knows it's serious. But when you have migraine, no one understands and few people care. And my favorite one is people with breast cancer, their loved ones gather around and support them. If you have migraine, your loved ones might even shun you, okay? So everyone, I feel, look at the left side of this slide and start embodying the things on the left side of this slide. This is the way you need to see yourself to start being empowered and not as a victim.
So here's some strategies so that we can learn to bounce forward. Focus each day on what you can do, not on what you can't do. Oftentimes we wake up and go, I feel lousy. I'm not going to be able to do 4 things on my list. Embrace impermanence. Nothing stays the same. Everything changes. Even our pain throughout a migraine attack changes even slightly. If you use your breathing, you'll notice that 5 minutes from now, your pain will not be the same as it was 5 minutes ago. I love using humor. I use it all the time. I use it with my doctors. My doctors appreciate it. It goes a long way. When I had my brain tumor and they were taking staples out of my head, I brought a staple remover with me. He thought it was, my neurosurgeon thought it was hilarious. Try to find some humor. We all know about distractions. We are really good with distractions. We're distracting ourselves when we're in pain. Practicing acceptance of what is. If it's a bad day, it's a bad day. We need to just embrace that. And of course, I'm a big one to advocate for mindfulness and meditation. And there are various different mindfulness techniques. They are not all meditation. You can have informal mindfulness techniques, whereas Lindsay said, you drive down the street and you just appreciate the beauty of the leaves and the trees, etc. You can practice mindfulness in every present moment. And I really feel that all humans need to identify their purpose. I had a really bad day yesterday. My purpose yesterday was just to rest. And that was my purpose. And that was okay with me.
So this is just my picture to remind everyone that to put a stick in the spokes of the chronic migraine wheel, stick in your thoughts, stick in your emotions. And as you practice this more and more, it's almost like it starts to become slow motion. You get a migraine and you're like, whoa, my thoughts just went bad. My emotions kicked in, and you start to see them. This is one of the tools I love to use. Some people think it sounds silly at first. It's so important. Vision boards. I always joke that this is why God created Pinterest. Don't follow Pinterest boards. They can depress you. But I've noticed I didn't have a pain-free memory because my migraines were there from my earliest memory. And as I started working with people with migraine, I noticed that this pain-free memory they had was really messing things up for them. They were always beating their head against a wall, trying to get back to that pain-free memory. Like one medicine might work a little bit, but they wouldn't notice because it wasn't their pain-free memory, So I try to refocus. This actually has 2 purposes. One is to refocus so that you're focusing on a pain-free future or a future with less pain, instead of always thinking of this pain-free past. That's the first reason. The second is, remember I talked about how resilience is how strong your true north is, how magnetic it is, how quickly you get back to it, or how well you stick there. This is the reminder of your true north. I don't care if it's 35 pages long in PowerPoint. This is who you are. It's your true north. If you go into Pinterest and you just cut out pictures, sayings, anything that reminds you who you are, what your goals are. Your goals are who you are. You don't sit there and say, wow, I don't actually do yoga. It comes from somewhere in you. If you are looking at that, you want to do yoga, go ahead, put it in there. These are your goals. And so, I mean, honestly, my vision board is really long now. I haven't counted the pages, but it's really long. It makes me stronger. It distracts me when I make it, when I have a migraine. And then I look at it when I'm feeling a little off. And I think this is a really, really important tool to get your pain-free future and focus on it, and to also remind you what your true north is. So another really important tool I like to tell people is to throw out your pain scale. Now, I understand if you're working with a physician or a care provider who needs your pain scale because you're on a new medicine and you used to be a 6 every day, you want to see if this medicine is going to take you down to a 4, fine, go ahead and have your 1 to 10 pain scale. But once you've done that, oh my gosh, get rid of it. Because if you really think about what your pain scale does, if you wake up in the morning and you're like, oh, okay, I'm a 6. I'm going to go into work and now I'm a 7. But if it gets to an 8, I don't think I'm going to be able to stay here. And oh my gosh, it's getting closer to an 8. What am I going to do? I need to come up with a strategy so that I can leave once it's an 8. And what are you doing? You maybe even without thinking about it, you are completely focused on your pain. And that is the last thing we want to be focused on. So I think the best thing to do is to think of 3 things. You're either thriving, you're functional, or you're homebound, bedridden. Don't think about these numbers 1 to 10, because I think that they're terrible for you and your wellness. And then in Super Zoe, the Migraine Hero, my graphic novel for kids, I have one that's for kids. They're either super, so-so, or bummer. So try to come up with 3 things. If you don't like those words, get new ones. But I really don't believe the 1 to 10 pain scale is good for us. Margot wants to say something.
I've heard one doctor say that they use red light, green light, yellow light.
Yeah.
So green light is a day you can function. Yellow light is you're not feeling so hotsy-totsy. Yeah. And red light is you're in bed. But in terms of your functioning, just keep it simple and we'll stop those automatic negative thoughts from preventing us from moving forward.
Right. So as a summary, we need to move from being a victim to being a person of empowerment. Put a stick in your spiraling thoughts and emotions so that we stop that chronic migraine bicycle wheel. Recognize and build the strength within you and change your relationship with your thoughts and your pain. We did want to quickly tell you guys about a couple books since this talk was so short. If you love this topic of resilience, there's an author called Rick Hansen who writes a lot, and Margot has a couple authors. I have the books here. One's called Hardwiring Happiness and one is called Resilient. Those are both by Rick Hansen, and Margot has a couple books to show too.
I recommended 2 books, but one is by a woman by the name of Vijamala. It's a mouthful, Vijamala Birch. She is the head of pain and meditation in the UK. She's amazing. She had a major spinal accident in her 20s and has developed all sorts of programs for people in chronic pain to move forward. And with her book comes a wonderful DVD. And the other book was Bouncing Forward from Dr. Linda Graham. And we've got those books listed and Eileen is going to put them in the info and resource folder.
And ladies, before I let you go, and thank you so much for all of this, we have a couple of questions, but I'm going to ask you one that's really important, I think. People are looking for, is there a source for the exercise of placing the hand over the heart, a place where we can find similar exercises? They said it was wonderful,
yes,
especially as somebody with anxiety.
Bouncing Back by Linda Graham. She has a number of, and another resource for that is Dr. Kristen Neff, N-E-F-F, who is the doctor that's done all the research in the United States on self-compassion. But Dr. Graham's book, Bouncing Back, has all of these practices in them as well.
Great. Thank you so much. And thank you so much, ladies, for cramming so much wonderful information into that presentation. We really appreciate you. Thanks again, Dr. Weitzel and Margot. We really appreciate you.
Thank you so much for having me.
Thank you. Thanks.
Our coalition is working together to solve the challenge of migraine and headache diseases and support patients wherever they are on their patient journey. None of this would have been possible without the generous support of our sponsors, who helped us bring Retreat Migraine to life digitally this year and support hope, community, and advocacy at such an important time.